Now, the annual stress index compiled by medical insurer Profmed has found that South African professionals are taking huge strain. The surveys, which comprises mainly of doctors, lawyers, accountants and engineers, found that about 37% are stressed out and more than 70% of those haven't sought help or support. I'm joined by Profmed Chief Executive Officer Craig Comrie. Craig, good evening and thank you so much for your time. Now, the kind of people that you as Profmed represent under your scheme would be seen by many South Africans as being relatively okay. The expectation would be that these individuals would necessarily not be as stressed as some of the findings of your survey suggest.
Yeah, that would be wrong, and that survey actually indicates it quite clearly. All professionals haven't been immune to the COVID-19 pandemic and all the stresses that come along with it.
And when we talk about some of your findings then from this year, tell us exactly how stressed South African professionals are.
Well, when we looked at the survey results, what comes through quite clearly is that, and we've done the survey for the last 5 or 6 years, so last year the levels of stress amongst the professionals were around 20% pre-COVID. And obviously we wanted to see the COVID effect on those professionals. So 40% this year said that they're experiencing significantly higher levels of stress. Now that stress is brought on not only by the COVID situation, but we also found that almost 70% of those surveyed indicated that their main stress was the fear of losing a loved one. And then only secondly, the fear of losing jobs as well. So we have seen during the pandemic and during the lockdown levels, we've seen professionals lose a significant amount of their income. So for a few months, they would have had no income, like many other South Africans. And they've had to try and go into debt and try finance their living expenses over the last few months. And that has resulted in additional stress in their lives. I guess the one thing that comes through also quite clearly is that people haven't been able to work through their stress very well. So we see about 40% of those surveyed, in actual fact, say how their sleeping patterns have suffered. Now, long-term underlying stresses in your life obviously can result in some long-term chronic conditions or mental health conditions as well. And so that's something we've been really concerned about as we've seen the results come through.
So when you conduct the survey and you're asking the professionals these questions, are you able to tell the percentage that are actually able to access the help that they need? So whether it's financially, whether it's psychologically, that support that's going to help them get through the period effectively?
Well, as a medical scheme, we do cover almost 35,000 professional families. And so very quickly from our claims experience, we can tell you that there's been a significant drop in those that are consulting doctors. And that's not just healthcare professionals, but it's also then the psychologists and those that have then significant chronic illnesses. And that's essential to avoid certainly downstream, more serious cases. So we've seen the claims dry up, and for mostly medical schemes might not moan about something like that, but we know that in the long term that may result in higher levels of hospitalization and more serious cases that we need to then treat.
Is that related at all to the fact that people generally over the lockdown were reluctant to go to medical professionals? GPs reported a significant loss or a decline in visits from people in general.
Yeah, if you look at it's quite interesting. So our survey is of our members, and almost 40% of our members are doctors and specialists themselves. But even amongst them, they've avoided and tried to avoid landing up in a hospital or even a clinic situation or even the doctor's rooms. And so there's definitely a fear of getting treatment. And so what many of the medical schemes have done, like ourselves, is trying to encourage members to engage using the digital platforms that we have. So the telemedicine type of platforms, just so that they can be sure that they are maintaining their health.
Craig, are we seeing a difference generationally in terms of how people are being affected by stress?
One of the indicators that we had from the stress survey was that about 40% of those surveyed were in the age groups 25 to 35-year-olds. And it was surprising, or maybe not as surprising as we thought it should be, that that group was experiencing significant stresses in their lives. And I think it's a bit of the COVID effect where they haven't been able to achieve all the ambitions that they've wanted to achieve. But certainly there's a growing mental wellness risk in that age group specifically. And so it is about making sure that we empowering individuals to be more self-aware, aware of what impact stress has on their lives, and then encourage them to seek professional help where they need. One of the key ways to actually manage stress is to exercise healthy behaviors, but also to make sure you have sufficient and more in-depth social contact with friends and family. So we often want to trust those that are closest to us, and so we encourage, despite social distancing, we certainly encourage people to engage with each other more in terms of the digital platforms available.
Craig, you raised such an important issue of mental wellness, and when some medical professionals speak about what South Africa is going to look like post-COVID-19 and people being able to fully recover. Mental illness is raised as what could be a potential second pandemic or second wave of COVID-19. Do you think that there's a high risk of that?
Oh, absolutely. There's a very high risk of that happening. I think the isolation that we've experienced over the last few months has just magnified what that could look like. So already we've seen, as people return back to being able to see doctors, that the mental wellness providers are actually being accessed more than just the normal doctors. So we have a concern in general that people experiencing stress will develop mental illnesses in the long term. And the way to prevent that is to make sure that you have regular interaction and engagement, and that you're more open to have an engagement with professionals that could help you.
And at the same time, of course, people are having to do all of this while also working from home and having to deal with the challenges that come with that as well. And, living with this insecurity about what the future may be, especially those who still are fortunate enough to have jobs.
Yeah, the second highest indicator was the fact that people were worried about their employment status and losing their jobs. And so we have seen that if you are privileged enough to have kept your job, people in the workplace, almost 45% of them felt more stressed within the workplace. There is the other side. Almost 30% of the individuals that we surveyed indicated that they quite enjoyed working from home. It was mostly in the categories of those that could perform administrative type of functions. So yes, it works for some and it doesn't for others, but it really is important that we maintain a little bit of that work-life balance in terms of whatever environment we're working from.
Sure. And of course, you as medical insurers have also not been exempt from all of this. Talk to me about the way in which you are trying to manage the situation. I would imagine that some of your members would also have felt the blow, and you've also had to implement some interventions to support them.
Yeah, we have for some time had a disease risk management program running, which both encourages people to be aware of themselves and their mental wellness status, and then also a group of very highly trained professionals who stand in the wings to assist those that actually need to access the healthcare and receive counseling as well. So we've had to put additional resources in place to make sure our members have access to these individuals. And we see the demand growing. Even over the last few years, we've seen that demand growing almost double digits over the last 3 to 4 years.